Mr. Chancellor Delegate, today's honorary doctorate recipient, Dr. William Dietz, was an aspiring pediatrician when a summer job changed his life, one of the many serendipities he told us about last night. The year was 1969, and the University of Pennsylvania medical student was running the dispensary at an Episcopalian mission in rural Guatemala. He met many people who were clearly suffering from a lack of nutritious food and began to wonder about the connection between immune function and undernutrition. At the end of the summer, he wrote a paper concluding that the medical and sociological factors behind undernutrition and associated diseases cannot be considered in isolation. C'est ainsi qu'a débuté l'exploration que le docteur Dietz a menée tout au long de sa carrière sur la nutrition, la dénutrition, la forme physique et l'obésité. Après avoir obtenu un doctorat en biochimie de la nutrition au Massachusetts Institute of Technology, il a consacré plus d'une décennie à la réalisation de recherches sur le métabolisme en association à son travail clinique, notamment la direction d'une des premières cliniques d'obésité infantile aux États-Unis. He's been credited as being the first person to ring the alarm bell on childhood obesity in the early 1980s, authoring the first study to demonstrate a relationship between television viewing habits and obesity. How very relevant today with all our screen time. When I started, he says, there were only 3 people working on childhood obesity in the USA, he has recalled. I've always been interested in questions that nobody could answer because those questions identify a frontier of knowledge. Almost any question I asked back then didn't have an answer. That insatiable curiosity and drive to find answers brought him to the International Obesity Task Force, where he became aware of the need for data to help shape policy. In 1999, just 2 years after being appointed director of the Division of Nutrition, Physical Activity, and Obesity at the U.S. Centers for Disease Control and Prevention, CDC, an abbreviation we all know now, Dr. Dietz helped conceive a landmark series of annual state maps tracking how rapidly obesity was spreading. In his 16 years at the CDC, he focused on solutions for reducing obesity, including developing the 1998 clinical guidelines on overweight and obesity that reclassified many normal weight Americans as overweight, creating the first U.S. body mass index growth charts for children, and adopting healthy food purchasing policies across the federal government. In addition to his role at the CDC, Dr. Dietz has been professor of pediatrics at the Tufts University School of Medicine and director of clinical nutrition at the floating hospital of the New England Medical Center Hospitals. He's currently chair of the Sumner M. Redstone Global Center for Prevention and Wellness at the Milken Institute School of Public Health at George Washington University. A scientist who is passionate about affecting real change, William Dietz is a visionary leader who has tirelessly tackled one of the world's most pressing public health challenges. Mr. Chancellor Delegate, I present to you William Dietz, so that you may confer upon him the degree of Doctor of Science, honoris causa.
Ladies and gentlemen, it's my pleasure to invite Dr. Dietz to deliver the convocation address.
Good morning. Chancellor McCall-McMain, Principal and Vice Chancellor Fortier, Chair of the Board of Governors, Mr. Panda, members of the Platform Party, proud parents and guests, and most of all, 2022 graduates of the Faculty of Agricultural and Environmental Sciences. I want to begin by recognizing your parents and families for their love, sacrifices, inspiration, and support. You can take great pride in your children's accomplishments and in the career choices that they have made. The darkness that has surrounded us for the last several years is brighter as a consequence of what your children have already achieved and the promise of what they will accomplish. Thank you. On this very special occasion for me, I want to acknowledge my wife, Nancy, who is here with our children, Sarah and Jonathan, and our oldest grandchild, Jack. Nancy has been an extraordinary spouse, an exceptional mother and grandmother to our children and grandchildren. I could not have accomplished what I have without her love and support. I'm extraordinarily honored and humbled by my selection to receive an honorary degree from McGill University, not only because of McGill's outstanding stature, but also for the recognition of the work that I and my colleagues have done. It's particularly fitting that I receive this Doctor of Science honoris causa from the Faculty of Agricultural and Environmental Sciences. The citation that you just heard emphasized my early interest in obesity and undernutrition. These remain the two greatest threats to global health. Although the prevalence of undernutrition has gradually declined at least prior to COVID-19, the rise in the prevalence of obesity has continued unabated. Despite persistent efforts over the last 20 years, policy initiatives to increase physical activity and reduce obesogenic foods across local, provincial, and federal sectors have met with spotty success. In response to these challenges, The Lancet, one of the world's leading medical journals, formed a Lancet Commission on Obesity and charged the Commission to stimulate action and strengthen accountability for the implementation of strategies to reduce obesity and its related inequities at national and global levels. I was honored to co-chair the Commission with Boyd Swinburne, a friend and colleague from New Zealand. The Commission consisted of 37 members and fellows from 14 countries, including Dr. Kuhnlein, from the McGill School of Nutrition. 22 disciplines were represented, including malnutrition in all its forms, food systems, including indigenous food systems, political activity, political science, and policymaking, climate change, urban planning, epidemiology, and the experience of people living with obesity. Early in our deliberations, we realized that obesity and undernutrition were linked to climate change. As we concluded in our 2019 Lancet report, these three pandemics constitute a syndemic of obesity, undernutrition, and climate change. They interact in time and place, they have adverse and synergistic effects on each other, and disproportionately and inequitably affect poor and marginalized populations, particularly in the global South. Recognizing that these three interconnected pandemics constitute a syndemic points to triple duty solutions that simultaneously mitigate and prevent obesity, undernutrition, and climate change. Greenhouse gases cause global warming. The sources of these greenhouse gas emissions in the US and Canada are similar. 10% come from the agricultural sector and 25 to 30% come from the use of fossil fuels for transportation. Global warming has already reduced crop yields and the micronutrient content of staple foods. Reduced crop yields and micronutrient content contribute to undernutrition and food insecurity among vulnerable populations in low and middle income countries. Reliance on fossil fuels for transportation increases greenhouse gases and displaces physically active transport, thereby contributing to obesity. Cattle production for dairy and beef generates methane, a greenhouse gas 80 times more powerful than CO2. And beef consumption contributes to obesity and other chronic diseases. Corn production for fodder and ethanol feeds cattle production, fuels car use, and is converted to ultra-processed foods high in calories, fat, sugar, and salt. Ultra-processed foods contribute to obesity. Current practices are unsustainable. The solutions seem obvious: reduce demand for beef, move to more plant-based diets, improve public and physical transport systems, and voila, we reduce obesity, undernutrition, and climate change. Nonetheless, efforts to address each of these pandemics have been met with policy inertia. People with obesity are blamed for their disease. Industries disavow their contribution to obesity and climate change. The effects of cattle production on human health and the planet are disputed, and the links between our contribution to climate change and undernutrition in the developing world is ignored. It's their problem, not ours. And yet it is our problem. Obesity, undernutrition, and climate change are global issues, and the same inequitable systems that cause food insecurity and undernutrition in low and middle income countries cause obesity in developed countries, and the catastrophic weather events that result from global warming threaten us all. Global food systems are controlled by multinational corporations that have increased the supply, demand, and the global consumption of heavily marketed ultra-processed foods, and subsidies for commodity crops and fossil fuels maintain our current agricultural and transport systems. Moving to more sustainable plant-based diets and transport systems will require concerted efforts and policy shifts to change demand. For example, one recent survey found that plant-based diets were ranked as the least popular climate-smart policy compared to more popular policy options such as adopting climate-friendly farming practices and reducing food waste. Federal policy is silent. Neither Canadian nor U.S. dietary guidelines recommend limiting red meat or processed meat products. The crisis of climate change and its effects on human and planetary health are existential threats that we must address. The challenge is no longer what we need to do. The challenge is how to develop the political will to do what we need to do. The sustainability and decarbonization practices employed on this campus provide a model for what must be spread and scaled. We must continue to focus on the science that supports the need to reduce greenhouse gases and rebut the doubts sown by those who support the status quo. It's time to unquo the status. We must not be intimidated by the power of the forces in opposition to the changes that we need to make, and we must not allow a sense of hopelessness to lead to inaction. The stakes are too high. Sir William Osler, professor at McGill's Institute of Medicine 150 years ago, provided sage advice to his students about their daily work, saying, "Think not of the amount to be accomplished, the difficulties to be overcome, or the end to be attained, but set earnestly at the little task at your elbow, for surely our plain duty is to do what lies clearly at hand." What lies clearly at hand for all of us are the multiple little things that we can do to mitigate obesity, undernutrition, and climate change in our own lives and the lives of our families, and the big things that we must do to change the policies and practices of our institutions, municipalities, provinces, and federal government. Remember that the Chinese character for crisis is a combination of the characters for danger and opportunity. Seize the opportunity. The Faculty of Agricultural and Environmental Sciences has given you the necessary foundation. It is now time to translate that science into policy. The world needs your passion, your energy, your insights, your discoveries, and your commitment. Finally, and most importantly, as you take your next steps, please care for yourselves and for each other, and most of all, be kind.